What is the difference between the mesocortical and mesolimbic pathways in schizophrenia? Have you ever wondered how certain brain pathways influence the symptoms of schizophrenia? Today, we will discuss the differences between the mesocortical and mesolimbic pathways and their roles in this complex disorder. First, let's talk about dopamine. Dopamine is a neurotransmitter that plays a key role in many brain functions, including motivation, emotion, and cognition. Within the brain, there are several pathways that dopamine travels through, but the mesocortical and mesolimbic pathways are particularly important when it comes to schizophrenia. The mesocortical pathway connects the ventral tegmental area of the midbrain to the prefrontal cortex. This pathway is essential for cognitive functions like decision-making, planning, and attention. In individuals with schizophrenia, there is often reduced dopamine activity in the mesocortical pathway. This decrease is associated with negative symptoms, such as apathy, lack of motivation, and social withdrawal. On the other hand, the mesolimbic pathway links the ventral tegmental area to the limbic system, which includes the nucleus accumbens. This pathway is involved in processing rewards and emotional responses. In schizophrenia, there is typically increased dopamine activity in the mesolimbic pathway. This overactivity contributes to the positive symptoms of the disorder, such as hallucinations and delusions. So, what are the main differences between these two pathways? The mesolimbic pathway is primarily associated with positive symptoms, while the mesocortical pathway is linked to negative symptoms. In terms of dopamine activity, the mesolimbic pathway shows increased activity, whereas the mesocortical pathway exhibits decreased activity. When it comes to treatment, antipsychotic medications are often used to manage symptoms of schizophrenia. These medications act as dopamine antagonists, which means they reduce dopamine activity. They can effectively decrease positive symptoms by targeting the mesolimbic pathway. However, if these medications affect the mesocortical pathway too much, they may worsen negative symptoms. Understanding these pathways is essential for developing effective treatments for schizophrenia. By focusing on dopamine activity in both pathways, researchers can create medications that better manage symptoms. For example, medications that specifically reduce dopamine in the mesolimbic pathway while sparing the mesocortical pathway can help minimize side effects while addressing positive symptoms. In the context of schizophrenia research and genetics, studying these dopamine pathways helps scientists and clinicians gain a clearer picture of the disorder. This knowledge can lead to more targeted therapies and improved outcomes for those affected by schizophrenia.